Welcome to the Millennium Counseling Center podcast, where hope is yours, it's time to soar. I'm your host, Oren Matteson. It's time to rise above and celebrate healing, hope, and recovery with the Millennium Counseling Center team.
Special thanks to Kaz Source, who helps us with the production of our podcast. If anybody needs any help or looking into podcasts, please reach out to Kaz Source at kazcontent.com.
Different centers have things that they call intensive outpatient programs. And what we did is put together an intensive program for individuals, although we don't call it specifically an IOP, we refer to it as an intensive recovery program. And the biggest difference between what we do and kind of what traditional IOPs do is that our focus is much more on individual one-on-one care versus group work. And that's not to say we don't like group work. We think groups are great. We think they're very valuable. And we think traditional IOPs are fantastic. I think that what it is that there's certain people who sometimes can benefit from some more individual care versus group work. And those are the folks who are a really good fit for the 3A program. The core of it is you are matched up with a primary therapist and then at least one other secondary therapist, sometimes a third, and you meet with your primary therapist every day. So it's a 30-day program. You are daily meeting with your primary, and then we have additional sessions that are with kind of these secondary providers that are all on our staff. Typically, that's based around, for instance, if you had somebody who was dealing with, kind of substance abuse and depression, then what we would do is your primary therapist would be somebody who specializes in substance abuse. And then we would also have somebody specifically working on very, kind of intricate parts of whatever the secondary thing is. Another good example is trauma. So all of our therapists, or most of our therapists, are EMDR trained. So you would be working with your primary on a daily basis, and then we would have you working on trauma several days throughout the week. In addition to that, we help them set up a daily recovery schedule every day. So basically what we do is we teach them how to do that. And, one of the important things about being in recovery from anything is making sure that you've got a, kind of a system and a plan of how you're going to do that. So what we do is walk them through that kind of a daily recovery schedule, and then they share that with us. And then we will go back and forth and kind of discuss that with them. That's separate from our daily session with them every day. And then third, what we do is they have the ability to reach out to us after hours. And that has become a really important part of what we do because many times, while they're in session, they're doing fine. Even throughout the day, they're doing fine. And then something happens later on in the evening and they really need that additional support. We find that really valuable because one of the things that we're trying to teach folks in early recovery is to learn how to reach out and ask for help and, kind of connect with people. And what we've seen is they feel more comfortable reaching out to us because we're meeting with them on a daily basis. They know us, they trust us, they know everything's confidential. And so they're more likely to kind of reach out to us a first time as opposed to somebody that they might meet in a 12-step group or a sponsor or something along those lines. So that's kind of the general basis of it. It's daily one-on-one work. Many days you have several sessions with different folks. And then we also have a homework piece, which when we're not virtual, people had the ability to do the homework in our office. As of right now, it's all virtual. So what we do is we help them kind of work through some different things throughout the day that they can do while they're not in session with us. That's going to help them with their recovery.
From more of like what's actually happening when that transition is happening from treatment to our program is that, people have just spent a considerable amount of time dedicated to like what's going on in their life. And it's very kind of individual focused. And they're normally within kind of four walls of a very contained place. And now they're coming back to a place with a lot of associations with really difficult memories, associations, conflict, whether it's kind of within a marriage or a family, or they maybe lost a job or something is happening to where they had to go to treatment. And so now they're coming back. And what we realized is that people need a lot more kind of individualized and personalized care. And, what people are coming back to, it's asking a lot of them to do it on their own. And so what we wanted to do was we wanted to kind of increase the amount of support we're giving to somebody as they're trying to figure out all those things. And because, like Derek said, you are kind of teamed up with 2 or 3 people, you have a lot of support and you have a lot of different kind of ways and perspectives to navigate those individualized things. Whereas if you are kind of in a more group model, you may not be able to get to all those specific things that are kind of going on in your life after coming back from treatment. And so I guess it really is for somebody that's coming back that just feels more overwhelmed with a transition back to their hometown, whether it's back into family life or work life or just starting recovery with all the associations of the city, and whether it's kind of alcohol or drug use or other things, it can be overwhelming. And we really wanted to focus on success rates, and we really wanted to focus on people thriving and feeling confident in their recovery. And for us, that meant just a lot more individualized care and a lot more attention to their specific needs.
The goal for all of us is to help people get healthy and well, right? That's the goal for everybody. The treatment centers, it's something that's amazing about this community that I see of professionals in the area we're in, is people genuinely want to see people get better. And so every program is set up in an attempt to help people get healthy and get better. And I think what all of the treatment centers know is that the aftercare is super important. You can do all sorts of great work in a residential treatment center, and if you come out and you're just thrown right back into your old life without any support, then the odds of you being able to be, kind of working through a successful recovery program are pretty low. And so the treatment centers that we work with love us because what they understand is that by working with the Millennium and 3A in an aftercare program, it dramatically increases the success levels as far as the folks who are coming out. And again, that's what we're all looking for. We're all looking to help people get healthy and to help people kind of navigate through this. And so these treatment centers that we've worked with for a number of years, they know that if they send somebody to us for the 3A program afterwards, that they're giving that person the best odds of staying sober or working through recovery or working through trauma or whatever it may be. So I think that's the benefit to them, is that they're handing off somebody that they care about, that they believe in, and they want to make sure this person's getting taken care of. And they have the confidence and faith they know we'll take care of them, because we will give them a lot of individualized attention and a lot of accountability. And Oren can talk through a little bit about the 3As, because I think that really tells you a little bit about what the program's all about.
Yeah, I guess it really starts with that, accountability. And, for me, the way I think about that is like, from morning until night, we're available. And so there isn't really going to be a time where you're kind of on your own through this. And, we want to be connected to you many times throughout the day to help offer that support and really kind of not have any gaps of time where you aren't accountable, where old mindsets and old ways of thinking can begin to creep in. That's a huge one. The personalized attention is kind of really what started all this, is where, each person coming into treatment or each person kind of figuring out their life and recovery is going to be different. And so we really wanted to be able to customize and make each experience unique for the person going through it. And lastly, the third A is radical acceptance. And for us, we want to continue to help foster the acceptance process that people are going through, of kind of who they are and what their struggles are, but what are their strengths and where they're going. Because if they're continuing to struggle with that, then their struggle and their recovery is going to be right there with them. So as much as we can continue to help foster radical acceptance in their life, we're pretty convinced that that's going to dramatically increase the quality of their recovery.
And to just kind of recap that's what the 3As are. Their personalized attention, their accountability, and their acceptance. And that's how we came up with those. And the name of the program is because we feel like those are really such an important piece of what people need to be able to work through when they're continuing on their journey of recovery. So anybody interested in learning more about 3A, we welcome any questions. We're always looking to kind of explain the program and talk to people about it more. I would encourage anybody who wants to know more to reach out to us. You can reach out to us directly. We have the information below, and we'd love to talk to you a little bit more. Since it is completely individualized and specialized, we do like to talk about each specific situation separately, so we can make sure that we're handling it in a way that's going to be most beneficial for the folks that you're thinking about kind of joining us.
Thank you for listening to the Millennium Counseling Center podcast. Where hope is yours, it's time to soar. Continue along your journey of healing, hope, and recovery with us next week. If you want to learn more about mental health, recovery, or if you just need someone to talk to, send us a message on Instagram or fill out the contact form on our website at millenniumhope.com. We are here to talk.